All right, hi guys, my name is Fiona. Welcome to the second part of our presentation. I hope you guys enjoyed Kiana's video. Now I'm going to be talking about the symptoms and pathophysiology of chickenpox and shingles. So first of all, chickenpox and shingles, like Kiana said, are caused by the same agent. Chickenpox, it's very common to be seen in children, but I did want to make a note and say that just because it's more common in children doesn't mean that we as adults or adolescents cannot get chickenpox. Early chickenpox signs and symptoms could include things like having a fever, having a headache, maybe having a loss of appetite. Those are all symptoms that we cannot normally see. Those are more internal, versus the common chickenpox symptoms, which would be, of course, that observable rash that we see on our body, the red dots, like this infant has here. They have little red dot rashes all over their body. These rashes can become fluid-filled and turn into scabs later on as it goes through the healing process. However, for shingles here, you can see this person has a much worse looking rash. They have very similar symptoms like the itching and the rash. However, with shingles, it is possible to have some sort of pain or tingling in that rash area. You can see here the rash is definitely more confined and clumped together versus this infant here who has more spread out dotted rashes. This is just one big rash, and you can also see at the top right up here the start of another rash. So it could be multiple rashes that are confined and clumped up to make one big rash, so multiple big rashes. These rashes can also come with an upset stomach or having chills as another part of the symptoms. So, for the pathophysiology, as we know, the varicella zoster virus is the virus that starts the entire um, infectious pathway. So, this virus will begin at its site of entry, which is usually within the respiratory tract. Within the respiratory tract, commonly the site of entry for this is the mucosa. That is where it will establish best. And once it is established, it'll go through replication. During the replication process, this will take place on our lymph nodes. This can happen in the matter of days to about a week, but until about that week mark, you won't be able to see any physical signs. So any rashes or dots or redness, anything like that, you typically won't be able to see it. It'll typically be until about a week later after this dissemination of the virus, you'll be able to see the rashes. And during this week or however long it takes for the rashes to show up before that, that is when the facilitation of our virus and the transmission is happening during this time as well. Um, it is very common that you may get some sort of complication or secondary infection. Other infections or complications can rise during this period of time because your body is not immune to this virus that is happening within your cells, especially for those who are maybe immunocompromised or have a complicated medical history. They are even more susceptible to getting complications. However, after the exposure of this virus to your immune system, this is when immunity is created, right? Immunity and start to fight against the virus. And in about a week or two, the initial infection from chickenpox will subside and chickenpox normally will heal itself. Once the infection is gone, however, the virus does remain latent, and we've seen that it is theorized to remain latent within our sensory nerves, which is why shingles can be reactivated later on. And if reactivation of shingles does happen, it is very painful because it is located within the nerves, and our nerves control a lot of feeling throughout our body. Shingles can be contagious if you have no prior immunity or exposure to the varicella zoster virus, but the transmission rate is low and it can only be transmitted through direct skin contact or some sort of inhalation. So next we're going to do diagnosis and treatment. And so, like I said, the symptoms to start out, I listed before, the rashes, the itchiness, and any sort of confined stripe of rashes or pain. That's usually a sign. And once you go to get diagnosed, typically a doctor will be able to tell based on a physical exam if you have chickenpox or shingles. It is a very notable disease with the rashes, so it most of the time it can be diagnosed just through a physical exam. But they may also look at patient history, your medical history, records, also lab testing that is available, some diagnostic tests like the polymerase chain test. This is also known as the PCR test, and this is the most preferred diagnostic test by doctors because it's the quickest, it's the most effective, and it's also the most accurate and sensitive in detecting any sort of varicella zoster virus DNA. It is just do a little swab and they can send it in, any sort of DNA from the virus with the DNA from your skin and from the rash. There are a couple other tests that can be done, like the direct fluorescent antibody assay test, or to grow viral cultures, but again, those can take a very long time. And then after the testing and the diagnosing, that is when treatment options start to come into play. Um, like I said, for chickenpox, it typically tends to heal itself in about a week or two. So in the meantime, applying or taking in some sort of over-the-counter antihistamine that the doctor may prescribe can help with the itching and the rashes. Shingles, it is a little different because shingles is that reactive. So is no cure for shingles because once it remains latent, there really is no way to take that DNA virus out of your body. But if your rashes are caught early enough, doctors can prescribe some sort of pain reliever or antiviral medication. This will help the healing process and it will help speed up the recovery time. And this can make symptoms more manageable, but there is no set cure for shingles. Section, we're going to talk about prevention and clinical relevance. Pox or shingles is by vaccinations. Getting your vaccinations in a timely manner at the right age, at the right time is the absolute best way to lower rates of chickenpox and shingles. For chickenpox, you're able to get the varicella vaccine. This is usually given in 2 doses, and you usually get this as a child because it's more common in children. Usually they give it to you when you're a kid. Between the ages of 1 to 6 is the most common when doctors will be able to give it to you. However, just because you're not a kid, that does not mean that you can't get the vaccine. It is still recommended that you get the vaccine if you haven't had any sort of exposure to chickenpox or any sort of immunity built on from the vaccine or having chickenpox. For shingles, the vaccine you can get, it's called the Shingrix vaccine. This is also given in 2 doses. The only difference is that for the shingles vaccine, you usually get it later on in life. You get it if you're 50 or over, so there's a little bit of a waiting gap in between the chickenpox and the shingles vaccine. But again, the shingles vaccine is still recommended if you meet the criteria for it. Vaccines have dramatically dropped the rates of varicella and herpes zoster virus, and these vaccines have seen to be at least 90% effective, and we've seen rates drop dramatically because of these vaccines. And finally, we're going to talk about clinical relevance. So I would say like one of the main points is to be aware that one causative agent, which is the varicella zoster virus, can cause 2 different infections in your body at 2 different time periods. These 2 infections cause a lot of long-term complications. One of them being post-herpetic neuralgia. This is long-term nerve pain, and it can really limit your activities and what you can do with your life because of how much your nerves control in your body. Modern time, we can lower it a lot by getting vaccinations. And these are our references. And that sums up our presentation. Thanks so much for watching. We hope you guys enjoyed and learned something, and we'll see you later.